seen is how healthcare has evolved in last, I would say, 6-8 months in terms of from where it was to where it is today. From where, from a kind of a background thing where, when you're sick, you access healthcare, to a frontline force to fight against COVID war. I think it's a phenomenal work that is done by the healthcare community across different, I would say, domains, different, expertise, and they've really come up to, the challenge, and delivered on innovation, care, solutions to, sort of cure, and every front. In fact, I saw myself doctors who are designing, apps and, products, and, creating solutions to make things easy for the pandemic, sort of to fight the pandemic, as well as to build new models of healthcare delivery. And I think, having said that, what we also saw was tremendous change in how healthcare was accessed. Like the way Dr. Alben was saying, that there was sudden drop in demand. I mean, at the peak of the pandemic, the demand dropped almost 80%, both on the patient visits as well as on the tests, and the operation theaters got empty. And I think that was a phenomenal shock for the system, though the COVID wards were busy and doctors were working, day and night. So I think that has led to a lot of shift in terms of how we see healthcare today, and how patients see their health, and how healthcare system wants to deliver care. So I think there's a lot of change in terms of how that experience could be delivered. We also saw multiple trends coming, into force in terms of personalized health, holistic understanding of healthcare, patient-centric approach to digital trends, to, quantified self, and a whole lot of these trends took a different meaning suddenly. And I think with that as a backdrop, I really want to invite the panel into, sort of discuss some of the points. So let me start with Dr. Alban, and this is the same question for all the panelists. So the question is about how COVID-19 has impacted healthcare system, and specific to your, business, or your company, or your way of part of the work, and what changes you noticed in your respective areas. What are the, sort of significant changes which you want to bring up, So, over to you, Dr. Alban, and then we'll go with Anu next, and then Abhimanyu.
So good afternoon, everybody, and thank you, Umesh, for this opportunity to be part of this panel. And yes, I did notice that we're all A's, and I was also wondering how my name got called last, because I was just trying to see Abhimanyu A B, but Anu is AA. Okay, then I thought, okay, maybe AL comes a little later. Anyway, so yeah, I think the objective of today's discussion is to understand about the impact of COVID and healthcare. I would like to maybe approach that in a slightly different manner, and I would say that see, healthcare has always been around trying to solve problems of people who come into the system. And if there's one thing I think Umesh touched upon in this, is that now COVID has created a situation that the healthcare has to go back to the community. And if you look at the history of healthcare, hospitals and other things, and the entire thing, the role of the doctor was initially that way. It was about you being within the community and taking care of people there. But it has slightly migrated away from that, being a separate entity, and people had to come there to access it. So I think that is a major change, I would say. And I would like to start with that positive kind of a change there, because we are slowly migrating back to what is our original role, playing a role within the community. And as a second thing I would like to say is that within the community also, it's created a necessity to understand the status of health. When we said that it's not merely the absence of disease, but a social, mental, physical well-being. I don't think that has never been given that much of value to what is the current need of it. People now need support at all these fronts. You need to be physically fit, you need to be mentally agile, and you should also be having a social environment, a social support. And I think everything came into play as far as healthcare is concerned, because when hospitals had to reach out, giving food and medicines and other things to patients. So I think these are the two major changes that I think has kind of, I would say, impacted, but just I feel like wanted to keep it very positive in the whole expression of what the impact is.
So I think at least from my vantage point, I think one of the things that we noticed is that even though India was always a consumer-driven market, and every consumer had a right to basically decide what kind of healthcare they can access, it is I think the doctor was always the deciding factor. I think what the pandemic has really done is to give the consumer the power and also the knowledge about health and healthcare in general. So I think today, for instance, if some companies like Mapmygenome have been talking about preventive healthcare, well-being, and immunity, and all of that, I think those things only got accelerated by the pandemic because it was for the first time, I think, that people were forced to think about health in a setting that was outside of their usual comfort level of going to a doctor when things are going bad. And I think that will sort of change consumer behavior and patient behavior in a way that will probably not COVID. Because one, I think COVID will have long-term implications. We are seeing that it is having effects on many different aspects of healthcare, and therefore I think the necessity for the consumer or the patient to sort of get that knowledge is becoming even more imperative. The other thing also which is driving this behavior is the fact that I think from a doctor perspective, they never had the time to really think about technology, to think about ways that they could also contribute into this. I think for the first time, I saw a lot of doctors who had a little bit more time and had a little bit time to think about how to become part of this technology aspect as well. So I think there has been a lot of positive changes, but that has also clearly, I think, it also showed that there was a lot of weakness in our system, and we are clearly do not yet have the best form of healthcare in the world. But I think it is time that if we are at a point where there is a possibility for us to take this challenge and make it one of the better healthcare systems, given that I think not many countries have the luxury of having a consumer-driven healthcare system.
Maybe, hi. So maybe let me take a little bit of a different take, Mesh, on the impact of COVID, because Dr. Alben talked about the industry and talked also about patients. Maybe let me also talk about my own world of design, how COVID affected us. Because, like, for instance, in Philips, and I'm sure it's the same for all design organizations, is that we talk about radical empathy for the people involved in the healthcare, delivery. And that is, of course, starting with patient, but of course, going to the doctors and, nursing staff and support staff, but right up to the CEOs and CIOs. Now, one of the main tools of actually practicing this empathy, what we have done is that we have visited the hospitals, because we wanted to kind of always observe people in their own surroundings, absorb their challenges, and something that maybe doesn't even come through in the interviews, to make those kind of latent observations about what their challenges, what their barriers, pain points could be. Now that became a big, of course, block, with the start of COVID, and we were not able to visit the hospitals, also for the safety of our own people. The second thing what we do in terms of radical empathy is that we get our stakeholders, again, the hospitals, the people who are involved there, in the co-creation of the solutions that we make, which means that basically not only we are talking to them about how we can solve their pain points, but in terms of the real methodology of how we are going through the steps of designing the solution, so that we don't want to cook something in our labs that when we take it to the hospital says, oh, well, we don't recognize it or we can't use it. So that co-creation process is also something where we invited hospitals to actually come into our labs and co-create with us. And that is the part, I think, where we saw a great opportunity to switch to online collaboration. So, like they say, never waste a good crisis. This led us to discover some really good tools online. And of course, these are the things that I think we are practicing, we are discovering. But this is also something that we wish to now keep as we go forward, because there are some really nice and lean ways that we are learning now, where we can actually cut down on some of the travel, some of the wasteful things that we were doing earlier in our design process, And so hopefully, when we come out of this crisis, I think the design process would have improved to almost like a next level, you can say, where we want to keep what was good about the way things were doing, but also now adopt to, this new normal of, being online and interacting with people online. You're on mute, Unmesh.
I should unmute all the time. So, yeah, I think this is a great start in terms of how things have changed and how you observe them. So, coming to in terms of say change has happened. So now, how do we see this change as an opportunity in terms of how we want to build on this further in terms of better healthcare, we said, or better kind of patient-centric health or better techniques. So where do you see some of the trends that are visible today, mega trends, big trends? How do you see them unfolding going forward in terms of new experiences or new ways? So maybe if we can just go in the same order, I think that'll be great.
Okay, so I think the empowerment of the patient and the possibilities now of uh, giving the responsibility on to the patient to play a participatory role in the healthcare as something which we should expand on. And I think that's what is the opportunity that is being created out here. And because we know very well that any amount of money, any amount of resources is not going to solve the healthcare crisis problem, and that has been proven time and again. But the only way that this can be changed is to be, make the responsibility out there, and I think that's something which we have to tap into and continue to push on that front. So the patient's responsibility of looking after themselves, keeping track of their medication, their risk factors, and enabling that part, empowering them to do that should be the opportunity that we have to create, is what I feel. And secondly, I think the adoption of digital healthcare using technology to reduce what I would say, waste in healthcare. The wastes of certain processes. Something very simple, I could say that, why should some patient have to come and wait in an outpatient department just for a follow-up of their medication? Now you have video consultation, you have chat bots, you have other means by which you can communicate. So you can keep the doctor also employed in doing something different, and you can keep the patient also happy. So things like that, bringing technology in a more useful way and empowering the patient to continue to take responsibility is what I would say ways of sustaining this change, and in a positive way.
Great. Anu, over to you.
I think at least what we have seen at Mapmygenome, we had started often consumer-driven profiling from 2013. And while many people had started doing it, at least some people did it out of curiosity and other things, but many they were not really looking at it for making a lot of their decisions beyond the initial. So I think what we started seeing was that this year, when in April, when COVID hit, and we had released the immunity and the risk report on COVID, which also included a lot of things that we had already done, and we gave this away to all our customers. What we found was quite interesting, that all of a sudden, I think everybody who had done tests from the last 7 years ago, everybody started to actually revisit and look at all their actual genetic risk factors, and they started to look at their counseling reports and look at a lot of things. And this was a large number of people suddenly coming back into understanding what is going on. So I would say that the interest is now becoming more, I would say, driven by the fact that they really believe that there is a need for understanding some of these new age information, and also that you can use this data to get additional insights into whatever your health information has to say. So that was one thing that we noticed. The other thing was that when we also became a COVID lab, and we could start to correlate some of that information to see if it makes sense from what we have been looking at, saying somebody has a risk for something versus correlating it with the research that we could now see with people who potentially now were COVID positive. I think that sort of data can become extremely powerful, because you can now really start to put in multiple pieces together where you have a prediction piece. And as Dr. Alben said, there is a, clearly the consumer is there, there's a participatory piece, there's a prevention. So there are the 4 P's that we talk about, the whole personalized medicine. And we're starting to see that all the 4 P's are now starting to come, and not from a natural organic way of why it should be there, but it is coming in because I think there is a necessity, and the necessity of COVID, and what the consumer is now starting to understand. We started to see that that is what is changing, and we are starting to see that this dramatic change is going to continue with all other forms of data as well, whether it is looking at other health data and putting all of those pieces of the puzzle together. And that will drive much more of medical and healthcare decisions in the future.
Mm-hmm. That's fantastic. So, Abhi, over to you. So, how do you see sort of trends emerging in your area? What you see?
Yeah. So I think I'm just going to build on a little bit what Dr. Alben and also maybe I'm saying. I think the one big trend that we see is the virtualization. And if you talk about virtualization of care, what we are saying is that how can we deliver care remotely? And maybe there are 3 different buckets of looking at it. One is, of course, like Dr. Alben was talking about, how patients interact with the doctors. Not just booking an appointment, but also like a video consultation and things like that. Then there is the other aspect of the provider to the patient, where we as doctors or the hospitals are able to monitor the patient's health at home, and that is done, of course, with wearable monitors or, home devices, etc. And the third aspect of it is, of course, provider to provider, where maybe large hospitals now actually offer services to maybe smaller setups to run their ICUs remotely. For instance, in the need of crisis, especially that might become very, very useful, because if you look at the rural areas of India, where the experts are usually clinical experts are not available. So at the front end, we see this virtualization of care, but also at the back end, where we talk about people-centric design. We also see technicians, for instance, like you are a new technician who joins a hospital, wants to consult his, like his seniors, but maybe a senior is not available on site for face-to-face interaction. So even the solutions where, maybe a technician is able to access an expert remotely at the press of a button, or even, for instance, trainings, doing them online, something that used to happen, physically within the hospitals, etc. So I think the opportunities for virtualization are tremendous, and we see a big thrust. I mean, as I was mentioning to you, Unmesh, recent Gartner study said that the whole pickup of the telemedicine has gone up from 3% to 30%. Even in the developed world, and where in the US people are seeing great opportunities now to reach out to those rural populations which didn't have access. So I think in terms of just the opportunity for technology and then, of course, design and others is tremendous.
It's fantastic. So we are coming to almost close, but I would say the third point is on where is the disruption happening. So I would request all of you to just say it in a word or a sentence, very briefly. Where do you see the disruptions happening? Doctor, over to you, doctor.
I would say patient engagement.
Okay.
That's
Anu?
a single word.
Over to you, Anu.
Sorry. I think when you look at just the whole concept of how we have moved into specialization of multiple fields and going to a doctor when you need it, I think there was a lack of presence of a family doctor. And I think getting data together for the doctor, for the patient over multiple things, whether it's lab tests, whether it's genetic tests, whether it's other information, I think in many ways it's done well, designed well, in a way that allows you to look at the data more clearly from a consumer point of view. I think that will truly help in building, bridging that gap that exists today between what the way consumer looks at their own health and how a doctor looks at it. So that is one thing. The other area that I think we will start seeing to change in the preventive healthcare and coming together of multiple data sources. Clearly, I think there will be issues on privacy and other aspects of that which have to be really thought into and blended into. But those I think will be the major areas where we feel that once consumers have more ownership of their data, once they are given a more easier access to their data, I think we'll start seeing that healthcare will actually truly start seeing technology emerge, not as just something nice to have, but something that's necessary to have.
Fantastic. Over to you, Abhimanyu.
Yeah, I would just say that I think just building on what again Dr. Alben said, I think if we have to really make transformative change in the patient behavior, for instance, I think the early detection and screening are the key to prevention and early recovery, and 24/7 monitoring, which is actually now within reach with sensor prices dropping phenomenally and wearable sensing being easily possible. In Philips we already have solutions in Holland, a sensor which is about like a size of a coin that you can put on your body for vital signs. So I think that's the dream situation where you are able to monitor your own health, you're able to give charge to people of their own health, and do it unobtrusively, so that they're not, constantly concerned about themselves and, about their own health, and they can just live life free of fear. I think that's the future.
That's fantastic. So I think it's been a great panel. I mean, if I had to just talk through, I think I just got a few takeaways. One is, of course, we're talking about healthcare reaching to communities, empowering patients, patient centricity, giving them control. I think that comes in very often. Patients becoming more aware. They know what preventative healthcare means and what technology means. I mean, instead of looking at genetic analysis as a curious kind of a thing, to more of an essential part of their knowing about their body and themselves. I think these are some of the phenomenal takeaways. I think what we also learned is in terms of how technology is now seen more meaningfully. I mean, I think the true meaning of technology is understood and true deployment. And in a way, this transformation is enabled by technology, be it wearables, be it telemedicine, be it genetic analysis, be it, possibility of doing 24/7 monitoring, and, be it patient monitoring and, watching themselves and their healthcare. I think this has been fantastic. I think this is like really, I would say, very inspiring, I would say, just to put it simply. And with that, I would hand it over to our host, Shivani. Please take over. I think there are some questions. So I think we have some time. So let's take some questions. So first question is, in your view, what are the ways in which healthcare facilities are trying to improve patient experience and make it more inclusive in India? I guess that's a question for Dr. Alban, if you don't mind answering that.
Yeah, it's a good question, and I think the answer is uh, we need a little more work to do on healthcare leadership. That is something which is not been given much of a focus on. So that is something which we need to have a transformation. But given the fact about quality, it is more about patient satisfaction. So I think from that perspective, right now, the what we are trying to do from a hospital perspective is to reach out to the patient within the comforts of their homes and address their problems so that they are less worried about their symptoms or their, but at the same time keeping them aware about the importance of coming back for follow-up or doing certain tests and taking investigations. So I think at this point in time it's about reaching out to the patients, and the more because they are not coming to the hospitals. So obviously there is a push for,
I think we
and that's
lost.
what is.
Thanks, Dr. Alban. Second question is, do we see smart hospitals as a need of the time? I don't know. When you want to take that, because I think Philips works a lot in experience, hospital experience, and patient experience space.
Indeed. Well, smart hospitals are very much something that we in Philips, and I'm sure companies like us are trying to think about. But I would say what COVID has also taught us is what Dr. Alben was also, I think, earlier talking about is how do you, maybe we should talk about smart healthcare. How do we take healthcare to people? Because hospitals in the end would be a finite entity, in terms of their resources, in terms of bed capacities and things like that. And of course, they will continue to have the importance. But then if we make people in charge of their own health, if we make people aware of thinking about health more as a journey rather than as an episodic thing, like, oh, something went wrong with me, therefore I need to go to the hospital. I mean, of course, hospitals today are not something that you go for an evening stroll, but by doing monitoring, by providing that monitoring and enabling our patients, I think we will truly transform the healthcare. And indeed, in that future scenario, the way the hospital looks also will be very different, because then the reason why you're going to the hospital will be very different than why you go to the hospital today, right? So I think you will still need that physical space to go and maybe have an elective surgery and things like that. You can't get a bone surgery at home probably, but I think most of it, if we can solve it where people are, we talk about these concepts of aging in place, so maybe we should talk about health in place, so that let people be there where they are and, keep them healthy. I think that's the dream I would personally subscribe to. So indeed, I mean, but if you talk about smart hospital, yeah, well, there's plenty of efforts that are going on right now.
Absolutely. Well said. Not smart hospital, but smart healthcare. So this is great. So next question is, how do you see online health consultation evolving and its future in healthcare? I guess, I don't know. Dr. Alban, you want to take that?
Sorry, there was something I didn't hear. Can you just repeat the question again?
How the online health consultation is evolving and its future in healthcare?
Okay. I think the online healthcare sector is evolving on two fronts. One is there's a sudden need to capture information, which otherwise, when a physical consultation was happening, was considered to be taken for granted. For example, previously when a patient walks into a hospital and is sitting in front of the patient, a lot of it is conversational, and through that conversation the doctor understands something and writes down something and sends the patient on his way. Now since it's in a digital world, there is more reason for the doctor to capture everything on the system, and it becomes permanent. So I think the online consultation is improving, I would say, data capture and information completeness as is happening. And I think that is going to be going a long way in getting continuity of care. You now be able to know history at different time points. Now, this was something which was difficult to enforce into in-person consultation. You tell the doctors to stop writing and start using everything on the print. There used to be a pushback on that. Now, because they're not seeing the patient in person and everything is online, there is more need for capturing everything. So there is a need for the digital platform to become more intuitive, more smart, and help the doctor to be able to ease out this process. But at the end of the day, there's a lot of data that's getting captured, and that is going to be the big drive. Like I was saying, data is going to become more valuable than gold or any other metal in the world or any other chemical in the world. That's healthcare data for that matter. And I think that's what is getting generated by this entire system.
Thanks, Alben.
If I can add one
That's a nice segue to, yeah. So sorry, go ahead.
Yeah, I was just saying that we have been doing, for instance, a lot of consultation. Most of them are online. And one of the ways that we've been able to do this effectively is that the system is designed in a way that unless the person who's doing the consultation feeds in that information, I think they cannot generate the report, which is necessary as a follow-on afterwards. And I think that sort of exactly points out what Dr. Alben was saying, that if you make it in a way that it's more intuitive, a lot of information is already pre-built into it so that the doctor or the consultant, whoever is the counselor is talking, doesn't have to write too much, but at the same time has to put in the key points that are necessary for data. I think it helps in both for the consumer as well as for the doctor. So I think that's something that's naturally going to evolve, and I think they'll get used to it as well.
No, that's brilliant. So I don't know if you have just short. I mean, I had a question and final and most important question for you, Anu, related to data again. And I think you are in genetic analysis. We talked about patient data. We talked about being family doctor importance. So how do you see, this data privacy and security and the concerns that patients will have? Because if at all I see that as a barrier, how do you see that evolving further, and what responsibility, care providers and industry could take, in this manner?
So because genetic data was always very well scrutinized, I think most genetic companies have a privacy policy in place, and that includes things like taking consent from the consumer, but explaining to them what that consent means. The second thing is that in most cases, I think the data is more valuable at an aggregate level rather than an individual level, from understanding trends and understanding what is going on. And so for most, at least in our case, for instance, when we take consent from consumers, it's not for individual data points, right? So it's not to say that for X person, we have this data and that can be used. But it is more to say that if I take an aggregate of people of certain region, can I start to find something that's interesting? If I can take COVID positive patients and I look at people with comorbidities, can I get some valuable information from them? So I think you have to start understanding the difference between saying something that's going to hurt the consumer, which is to say that if that data being exposed on an individual level, that can never be exposed, right? So for instance, when we work with players, you have to make sure that the consent comes from the consumer, not from the party agreeing with this. And I think that way you're keeping the individual consent of the consumer, but you're also, if consent is given, then you're able to get more informed decisions for an aggregate level. So I think there is a distinction between the two kinds of data. And it is valuable for a consumer also. I think when you have data, for instance, if you sequence the whole genome, for instance, you have 3.2 billion instruments. Today, if that information is there and we only understand some part of the genome, it will give information related to that. But over a period of time, let's say more research comes into being, you can always update that information. And so for the consumer, there is value in keeping that data for them. And so there is value for them over there, but at the same time, it's not that anybody needs to expose that data outside of what the consumer and that testing lab is doing. So I think that's the difference. I think we need to make sure that difference between individual data that can be harmful for a patient to expose versus something that can be valuable for a long time for research and for knowledge based people.
Absolutely. I think that's a brilliant way to look at what data means, from individual to more, sort of global or a population scale level. That's fantastic. So I think it's been a really great panel. I think we are over the top of our time, and I think a lot of takeaways. I think it's very clear in terms of what the messages are and what challenges and opportunities are. I think this is fantastic. Thanks so much, Abhimanyu, Alben, and Anu, for your valuable inputs.
Thank you.
Thank you. Thank you, speakers, for this amazing sessions. I would like to take this up our gold partner, Human Factor International and Adobe, Design Challenge partner, Facebook, Knowledge partner, UNICEF, Country partner, Catalonia Trade and Investment. We'll take a small break. We'll be back for the next session. Thank you.
Thanks so much.
Thank you, everyone.